Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome back to quite a nice video. We've got a very, very dense, hard pack of dead skin completely blocking the ear. Not really much pain, but there's a hearing loss there and a sense of fullness. Now, as you can see, immediate failure with the suction. So I'm going to use this little hook here. Now, the reason I'm uploading this particular case is because I wanted to test drive this hook. This is actually a new device that was sent to me by a company abroad. So I actually get sent various gizmos, every month. Most of them are just kind of ear cameras, which I've shown before on the channel, bee-birds and such. But occasionally I do get surgical companies sending me tools, and this is one of them. Now, for the most part, when I'm sent tools, they're either too large or just not really appropriate, or they're like, quite dangerous. They're like knives or, needles, things like that. This particular one looks to be a kind of replica of a Cawthorn number 5 or number 6. I'm not really sure, but it's really, really good. The reason it's good is because it's, you can't really see it, but the side of the hook, the side of the L bracket or right angle that's towards the patient's actually kind of beveled a bit like a diamond. And then obviously the face of it, the bit of the L bracket that faces us, is nice and flat. So it's really good for sliding past debris and then hooking it out. It's good for it's very nimble, basically. It's slightly better than the hooks that I normally use, which are kind of just round and smooth. So we've managed to disturb all this debris. Now, you'll see with the Crocs, I'm kind of doing this up and down kind of rocking motion. That's deliberate because if I just did a straight pull, all of that dead skin would just tear and I'd end up with like a tiny little morsel in the jaws of the crocodile forceps, which is what we don't want. So if we ever do grab a nice big wad of wax or dead skin, we usually try and walk it out of the canal. And if we're patient enough, then we usually get a good payoff. We get a nice big chunk out of the canal, and we don't have to waste our time going back in again and again and again just by kind of taking little snippets. Now, the interesting thing here is that I'm feeling a lot of resistance in my hand when I'm pulling on this debris, which is not really what you want to feel. If you feel like you're really having to, wrench it out of the ear, chances are you're going to end up with trauma. Probably not serious trauma, but if the dead skin and stuff is adhered to the drum, which is rare, but it is in this case, then what you will, probably unlikely to perforate the drum, but what you will end up with is quite a lot of pain and some trauma. So you might have a lot of hematoma on the eardrum, which hematoma is just bleeding underneath the skin, which is basically a blood blister or bruising, which again is not, just not overly serious, but patient's not going to be very happy. They're probably going to be in a lot of pain and they will have a hearing loss until that blood blister goes away. And sometimes they can take ages to go away. So we're just going to disturb more of this debris with the hook. Again, it's doing a very, very good job. I won't, I probably sound like a broken record on this channel, but I've complained enough about the normal St. Bart's hooks in various videos. This is clearly much better. If you're an audiologist or a nurse doing earwax removal, get yourself a Cawthorn hook, as long as it's not sharp. There are non-sharp ones available online. So we're going to go back in, clear away the rest of this stuff with the Crocs, and we'll deal with the last kind of sheet. And you'll see exactly what I mean by the fact that it's adhered to the drum. Probably in retrospect, I probably should have drowned the ear in some peroxide or sodium bicarb, and that would have actually just kind of, allowed me to peel it off quite easily, or I could have gone in with suction. We do have some new drops actually, some pH balanced peroxide drops, which I'll show in the next video, but they're really, really good. So just getting this last little piece, and then we'll start on the main offender. So underneath the sheet, you can see this kind of grey-blue skin, see right there? That's the eardrum. So as I'm pulling down, you can see the sheet actually peeling off the drum. Hard to see, let's look underneath. there. You can see the yellow sheet coming away from the drum. It's not particularly painful. Patient is just feeling a little bit of tickling, a little bit of pulling, but and I'm watching here with the endoscope very closely as to what I'm doing, and everything looks fine. So I'll pull this last little bit of snake skin out, clear up, and thankfully there's not a huge amount of trauma. There's no hematoma or petechia on the eardrum. So petechia is just like little tiny little dots or splotches of bleeding underneath the skin. Canal does look sore. So we sent this patient round to the pharmacist for some acetic acid drops or ear calm, which is 5% vinegar. And what that's going to do is just, I suppose, act as a bit of a prophylactic, really. So I'm not seeing any infection here whatsoever. But of course, if there's trauma, there's a chance that it could get infected. So, 3 to 5 days of acetic acid will help with that. Question is, will we get this last little bit of dead skin? It's a gamble, but spoiler, we do get it in the end. So there we go. There's still a little bit of dead skin on the drum, but I'm quite happy with how this looks. Patient can hear much better. And I was quite pleased with how the hook and the crocodile forceps worked together. So I'll try and upload a few more videos of me using this hook, but it's really good. I think I will probably order some more, and I will probably end up blunting it a little bit deliberately because it is rather sharp. There it is. You can see just how tiny it is. And that's why it's so good. That's why it's so useful. And it's kind of angled a little bit, so it's not a total right angle, which I actually quite like. It's quite useful. So there we go. Quick one today, but I hope you found that video helpful. If you have any questions, leave them down in the comment section below, and I will try my very best to get back to you. And of course, I will see you guys on the next video.